Hey, now it is. So, following approach, the following approaches of raising filtrate rate may result in a decrease in bed porosity. Hey, bad. So you have including filtration aids, use of large filter, raising pressure differential across a filter cake, periodic removal of the filtrate cake. See, raising pressure differential across the filter cake. Okay, George is saying C. I cannot refute nor deny. Yeah, I can't refute or agree what I'm saying. So yeah, raising the pressure differential across the filter cake. I don't even know. George, would you explain what that even means? Yeah, as we go on, the expression of the concentration of a solution is percentage weight in volume means the grams of a solute in a liter of solution, the milligrams of solute in grams of solution in 100 ml of solution. Yeah, so I do with that one. In assessing the quality of mixing, the number of particles assessed will increase with a decrease in number of particles assessed will increase with a decrease in density, sample weight, bulk from which the sample is drawn, time of mixing. Okay, inaonekana hiyo imetuchanganya. Mm.
Not sure, but maybe B.
The number of particles will increase the decrease in sample weight. Yeah. Honestly, I can't. You're so deep.
Volume will increase.
What?
Could it be A because now the volume will increase? I'm not sure, but from just density equals
You
to
said
mass of volume. I guess.
yeah. Asmahan, I can't hear you well.
Oh, alikuwa nasema
Mhm.
could it be density because now that means there'll be an increase in volume, like from density equals to mass over volume. I'm just guessing though. Sijui.
Decrease in density. Okay. That's so how does mixing affect how does the mixing affect the density? How does mixing affect both the density or the sample weight?
Wait, sijui.
In layman terms,
Uh-huh.
I'm thinking C because the question is asking, removing the first part of the question. Second part is asking, the number of particles assessed will increase with a decrease in what? So why C? There'll be a decrease in the bulk from which the sample is drawn. So if you have all of these, for example, lactose, 1 ton of lactose entering the mixer. So the number of particles of lactose will increase when the bulk is decreasing, will be drawing from the 1 ton of lactose. So that's layman terms, again, also guesswork. But for the sake of Wednesday, I'll go with Asmahan's answer. Just today, I have a different opinion.
Okay. Shina, why did you say sample weight?
I was just doing pinky ponky. I don't know.
Because if that's the reasoning, guys, Sibasi also the sample weight is decreasing if the bulk from which the sample is drawn is decreasing.
But you see, when we say sample, the bulk from which sample is drawn, it means the sample is what we are getting after the
Also
mix.
the bulk.
Yeah, so my assumption is the sample weight is increasing and the bulk weight, I know I'm talking in terms of weight, but bulk weight will decrease.
Okay.
Yeah. But again, to be honest, I don't understand what the question is asking.
Yeah, that's true. So Asmahan, convince guys on the density part. He seems to be wanting to side with you.
Sorry?
When you're talking about density is equals to mass over volume, what was the correlation to the question?
It's like when the volume is increased, the density. Okay, super.
Which volume are you increasing? Okay, sawa. Haya, so pia mi sijaelewa swali based kama venye guys ameelezea, but it still makes sense. Eh, are we in the same class? I Segregation of particles by percolation occurs when small particles are blown up by air current. I still don't understand C. So C, and explain when you have like a bulk, the bulk sample, right? Like the bulk thing that is being mixed up. Yes, he was using maybe salt and sugar. As you mix it up, when you draw a small sample from that mixture of salt and sugar, these the bulk will end up decreasing because you've taken up like 5 grams from it. So the bulk from which this sample is drawn from is decreasing. The number of particles will increase because you've taken 5 grams from it, the particles you're assessing, but the whole sum has decreased. If it was like 50 grams, now it's 45 grams. So now that one has decreased. Does that make sense? That's how Gaius was explaining his answer. Okay. I think we went to Shina. Segregation of particles by percolation occurs when small particles are blown up by air currents, fine particle segments and fine particle sediment and settle on top of coarse particles. Small particles pass between large particles to settle at the bottom of a container. Small particles are separated from large particles due to the distance moved by the large particles.
Sorry, before we go to this, I just want to say that we could talk about mixing. I've just found the notes for that.
Okay.
Yeah. So we know what mixing means, yeah? Just so the reason for mixing is to ensure that even distribution of the active component, ensures an even appearance, ensures that the dosage form releases the drug at correct site at the desired rate. And so they could be mixing, powder mixing, they could be mixing of the miscible liquids, mixing of the immiscible liquids. Then there are types of mixtures. So we have a positive mixture that are formed from materials such as gases or miscible liquids, which mix spontaneously and irreversibly by diffusion. Then you have the negative mixtures. The components will tend to separate out. If this occurs quickly, then energy must be continuously input to keep the components adequately dispersed. An example would be the suspension formula, like if you take calamine lotion, when there's a dispersion of solid in a liquid of low viscosity. In negative mixtures, the components tend to separate very slowly, like emulsions or creams. And they're more difficult to form and maintain, and they really require a high degree of mixing efficiency. Then you have neutral mixtures that are normally static in behavior. Example is powders and pastes. Then regarding this question, there's something known as scale of scrutiny. It's mainly used to mix large mixtures or bulk mixtures. So they say the weight or the volume of a dosage unit indicates how closely the mix will be analyzed. And the number of particles depends on the sample weight, particle size, and particle density. So an increase in sample weight increases the particle size and the density decreases. So the answer is density. If the particle size increases, the sample weight will also increase, but density decreases. and you should evaluate the degree of mixing. It's monitored by to indicate the extent of mixing, to follow a mixing process, to indicate when sufficient mixing has occurred, and to assess the efficiency of a mixture. Yeah.
Very nice, Shrina. That is what you need. So, segregation of particles by percolation occurs when small particles are blown up by air currents, fine particles sediment and settle on top of coarse particles. Small particles pass between large particles to settle at the bottom of the container. Small particles are separated from large particles due to a distance by the large particles. We can start by someone telling us what is percolation. Okay, because one I knew was one for like liquid straining rather, like making tea or making coffee. Also, somebody has told us the small particles are separated from large particles due to distance moved by the large particles, that is trajectory segregation.
So then the answer will remain as C. Because I feel like B is sedimentation.
Because I feel like D is sedimentation.
Yeah.
D or B?
B. CD imeandikwa kwanza. B.
Oh,
So I feel like the answer is C. I'm not finding anything in terms of population for soil, like in between studies, because everything is behind a paywall.
yeah.
Yeah, so I feel like that's what makes the most.
Somebody who AI has told us segregation by percolation is a phenomenon that occurs in granular materials or particulate systems when different sized particles or components within the mixture separate due to variation in the ability to flow or percolate through the material. In this context, it refers to the movement of particles through fluid, thus a porous medium, etc. B is illustration segregation. Where you guys are reading. Okay. So you started first. One advantage of using ionizing radiation is analyzing agents is that they
Nasikia tofauti hizo ugali.
So one advantage of using ionizing radiation as analyzing agent is that they do not affect the potency of formulation, do not raise the temperature of particles being raise the temperature of particles being sterilized, have no effect on conduit. Okay, so advantage of using radiation, ionizing radiation. Can you say do not raise the temperature of particles being sterilized? Okay. Hydro preparation can be preserved the following compounds except, yeah, that's hydrogen peroxide. Somebody said the benzalkonium chloride is still the one that causes, is the one that causes reaction also in the eyes. I'm asking. Okay. And we are done with that paper, unless you want us to do the CQs too.
Maybe we can do the matching.
Oh, the matching ones. Okay, sure. So match each of the following compounds with a botanical name. Morphine will be Papaver somniferous, I think. I don't know, I'm not sure. Quinine will be Incona. Vincristine and the others. Pilocarpine. Pilocarpus. I'm guessing because of the name. And hyoscine will be the Datura stramonium. Now let me know if I've confused any of them.
Maybe we can also use do the where, like, which part of the plant it is and the uses.
Okay. So poppy. We use which part of the plant? I'm not sure which part of the plant we use for the morphine. Who knows? Vincristine nimesema niyo Cantharanthus. Yeah, somebody can help us with the parts of the plants that are used.
I think quinine is the back. And vincristine would be the flower.
And I'm finding um
You said vincristine is
Cantharanthus. I'm finding for vincristine is being extracted from the leaves.
Which leaves or flowers? It's those pink flowers, if I'm not wrong.
Yeah, the pink periwinkle.
Yeah, so those are the flowers. For
no.
leaves, I think is digitalis, eucalyptus, the tobacco leaves, and Atropa belladonna.
You sure? Because
For morphine, it's not the flower. Morphine is the unripe capsule or seed.
And Hiral, a question.
Yeah.
Which of these botanical sources were we saying is disorganized? Because the product can, I think, be obtained from the flower, I don't know, the leaves, something like that. Was it morphine? Or which one was it?
I don't remember.
Okay.
Yeah, you're right,
When did
Sophia. It was morphine.
Okay. Thank you.
Opium, opium.
Are we yet discussing this? Or we are done?
I think we're done, unless somebody wants to tell us more that's extra.
We can also do number 12. There's another complicated paper I think we have to discuss, so maybe if we could finish this faster.
Aye. Pharmacological factors, actions of the following agents. So we have filgrastim, actions used in hydrogen. Who knows the pharmacological action, the mechanism of action for filgrastim?
It's a granulocyte colony stimulating factor.
Poietin alpha,
Erythropoietin.
Okay. Baclofen,
Muscle relaxant.
pentyl sodium,
Sedative, hypnotic, or barbiturate. I don't know what you could say.
and the atosiban.
Is it the short acting or long acting?
Short
That
act.
is short, yeah.
And the last one is an inhibitor for oxytocin and vasopressin.
Yeah, it's
So
a
it's
chocolate.
It's ultra short.
yeah, sorry,
Yeah.
it's ultra short.
The last one is a
Atosiban is
chocolate.
said- Yeah.
Sorry, what is the last one?
Tocolytic.
It inhibits oxytocin and vasopressin, so it's a tocolytic agent.
What does tocolytic mean?
That means it inhibits
Then-
oxytocin.
Levels.
Tocolytic basically like it postpones delivery. So it's basically the opposite of oxytocin, yeah.
Can we do the uses for each of them?
I think it's in their names. Or filgrastim granular site stimulator that will help
Okay, yeah.
used in each of
Yeah,
them. Yeah.
It's okay.
Oh, this other paper. Okay. In which type of drugs is the material being dried mobile during the drying process? Tunnel drying, free dyes, bed dryer, a rotary drum, spray dryer. So in which is a dried mobile during the drying process? I think it's a spray dryer. I don't know. No, it can't be. Vanessa is telling us tunnel dry is a machine where a container or tray is filled with the material, is placed in a trolley, or the material is loaded directly on the trolley, and the trolley is pushed in from the tunnel chamber entrance. The material is dried by being moved through the drying chamber. Okay. So in this case, it's being mobile. Ah, okay. The boat rotary. A rotary drum dryer is one where we put them and then the thing rotates. Mm. Well, seems like even in the rotary, it's also moving. Yeah. So between the fluidized, between the tunnel and the rotary drum dryer, they both seem to be mobile. B according to G. Fluidized bed dryer. Okay. Okay. Right. So internal dryer, we have like we put the powder, whatever material it is, on a tray, and then it moves. So that one is still moving. Fluidized bed dryer, that's like the one we have. Is it the one we mainly have in industries where they put that? Okay, what shule wameiona pia. No, I am not sure honestly. This one I'm not sure. Inaonekana pharmaceutics inaletea watu shida hapa. Because if you think too hard about it, you'll end up having all of them being mobile. So I don't really know. does somebody understand this better? I think tunnel and rotary ni kama zina tie, but now ChatGPT is saying fluidized bed dryer. So food for thought. We'll flag that question back to it. In which type of drugs is the material? A key side effect of erythropoietin is. I've moved on to the next question because that question seems to changanya people. So let's move to the next question. George ashatujibu. A key side effect of erythropoietin is hypertension.
Okay, for this one, it is fluidized bed dryer because the advantage of fluidized bed dryer, it says the container can be mobile, making handling and movement around the production area simple, hence reducing labor cost. I don't know if that makes sense.
But I think that's talking about the equipment itself.
Approach
Which even
erythropoietin. Hakuna choices.
I think that question must be somewhere down. We can just go on with this question for now.
I mean nini George amesema ni hypertension. In the management of Parkinson's disease, L-DOPA and carbidopa are co-administered with. Two guy. They are co-administered to improve penetration of the blood-brain barrier, potentiate the effect of individual drugs, prevent peripheral metabolism of L-DOPA, and relieve cholinergic side effects. And Dash has told us its prevention of peripheral metabolism of L-DOPA. And how does it do it? I mean, it's in the answer. Actually, which are the following scenarios?
Sorry. Can we just go through Parkinson's, please?
Yes.
I think we're yet discussing, right? Or we're just answering questions?
We can also discussing.
Thank you.
So what is Parkinsonism?
So it's a disorder of the CNS system. It affects movement and includes tremor. So there's gonna be nerve cell damage in the brain, which causes dopamine levels to drop. That leads to the Parkinson's system symptoms. Yeah. So the medications would be a dopamine promoter, like L-DOPA. Yeah, that's the main one. But it's not important to note you can't treat Parkinsonism. The aim of getting this medication is to manage the symptoms and manage the progression of the disease. Yeah.
Nice. Can somebody tell us how, or that a more detailed explanation of why we combine carbidopa and L-DOPA, like the enzyme that's inhibited, the breaking down of the L-DOPA, all that shebang.
Levodopa is a decarboxylase inhibitor. So peripherally, it will inhibit the decarboxylation of L-DOPA. Thus, now will increase the fraction of L-DOPA now that is available for it to cross the blood-brain barrier. It's a peripheral decarboxylase inhibitor together with benserazide. Yeah.
What about other treatments for Parkinson's except for the carbidopa-L-DOPA combination?
Can use dopamine agonist,
Mhm.
such as bromocriptine.
Yeah, any other? I think here the anticholinergics, the COMT inhibitors.
I think even the MAO-B inhibitors, the rasegulin and the selegiulin, it inhibits the MAO-B, so blocks the dopamine breakdown. And it's usually used along with levodopa to prolong the actions and reduce the dosage.
Okay.
Also amantadine, that is an NMDA type glutamate antagonist. It slows the rate of nerve cell loss in the brain, so slowing down the progression of Parkinson's disease.
Okay, that's nice. Somebody has talked about the tolcapone. Okay, just can also be used in combination with L-DOPA to prevent the degradation of L-DOPA. Any more addition on Parkinson's that you have left out that are important?
There is COMT inhibitors kama imesemwa entacapone.
Endelea tu, tumesema, but go ahead.
Oh,
What do you know about it?
just kidogo tu.
I think maybe if someone remembers the names of the pathways through which, by using anticholinergics, you can increase the dopamine levels. Someone can share that, please. Other than just masking the tremors and the like.
Like why we use the anticholinergics. Amma?
Yeah, that's what I'm saying. Maybe if you have, like I know it can reduce the tremors and such effects, but does it also have a role to play in increasing dopamine levels? Come on, was there something like that?
Okay, what I know is that it's not that they increase dopamine levels, they usually use as adjunct because like in a normal brain, we usually have a balance between cholinergic excitation and dopaminergic inhibition. And then now in a Parkinson's brain, now we have more of the dopaminergic. It's like there's an imbalance. Yeah, and less of the dopaminergic and more of the cholinergic, and that's why we give the cholinergic antagonists.
Yeah, that's exactly what I was saying. Thank you.
Yeah, thanks so much, Asmat, for that explanation. Somebody is asking pramipexole. I think it's also used in Parkinson. I don't know what its mechanism of action. Bind selectively to
I have a question. Why don't you give the first generation antipsychotics with levodopa or carbidopa?
that is a good question, Shrina. Somebody wants to answer her.
Those are not for schizophrenia. Which cause the extra pyramidal symptoms. Come on.
Antipsychotics, they are antagonists of dopamine, and in Parkinson's, you to increase the dopamine, so it would worsen the effects.
Yeah, exactly. But just generally, we avoid first generation because of the extra pyramidal effect.
Okay. Could you move on to the next one? Have we exhausted on Parkinson's, or does somebody have another question? Okay. Which of the following scenarios does not involve the presence of any symptoms? A 44-year-old male with abdominal pain and severe dizziness, a 49-year-old with blurred vision, a 55-year-old with a severe headache and nausea, 61-year-old female with who is unconscious with facial cyanosis. We're having split votes between B and D. So somebody says 49-year-old woman, man is not.
Blurred vision is
So
something
somebody
patient would describe that I'm having a blurred vision. Symptoms are things that the patient will describe, and signs are which, like, you have to do tests or something. I don't know how to describe that, but yeah. When we say unconscious with facial cyanosis, the patient is not able to tell you what is going through, so the doctor has to see it. I hope that's clear.
Yeah, the symptoms are more of what you'll observe, what you see. I think the signs are more of what they tell you.
Isn't it the reverse, Janet?
The other way around.
The other way around.
So the signs is
Yeah.
what you see, and the symptoms are what the patient tells you. That's
Yeah, yeah. Yeah,
Oh.
exactly.
Ah. Okay.
I was wondering, for this question, we couldn't have thought that at 4950, you expect generally the eye not to be in peak condition. So maybe the 49-year-old, like the blood vision is just due to a deteriorating eye. So it's not necessarily like a condition or anything. It's just age.
But I think that in itself is a condition.
Oh, fair enough.
Janet,
Yeah.
I have a question.
Uh,
Like, let's say in the case where you perform like the Carnegie's test, yeah?
mhm.
When you're testing for meningitis and there's a positive response. So will that be a sign or will that be a symptom?
Mm,
Sign, okay, so thank you.
mechanic signs. Yeah. Shina, is she? The most likely complication of prolonged use of nasal decongestant drop is atrophic rhinitis, hypertrophy of the nasal mucosa, blockage of the eustachian tube, nasopharyngeal moniliasis. Like it to be A. It causes a rebound rhinitis. I don't know if the rebound will mean atrophic rhinitis.
Seminar ya Indonesia.
Yeah. Me too.
Janet, for that previous question, why not D?
Why not the nasopharyngeal one? Because I don't know what that means.
Because I thought we said with this what are they called? Oh, nasal decongestant. Oh, so anyway. So
No, you can just tell me what is that
No, I
first of
was
all.
thinking, no, I had confused nasal decongestant with what are they called? Inhaled corticosteroids, the ones you unatumia kwa mdomo, then you can get those candida infections. That's what I was thinking about. But yeah, okay.
Ah, so moniliasis is candida infection. Now I know. Ah, yeah. So we can go to the next question. Which of the following drugs should be avoided in children under 4 years with diarrhea? Bismuth, metronidazole, bisapadil, loperamide.
Okay, I'm seeing that you can't give bismuth, this subsalicate, because it's derived from aspirin. So it can cause the Ray's syndrome in children. So it's only given to more than 12 years old.
People are saying loperamide. I have to be saying loperamide.
What with
Because, huh?
what is usually the most common cause of diarrhea in pediatrics? Is it viral? Is it bacterial? Because if it's viral, then I think Shona might be correct. Because yeah, aspirin also worsens viral infections, predisposing to the Rice syndrome.
Shouldn't I be told to repeat your answer, rather your explanation?
Okay, so it can cause Ray's disease. Is it disease or syndrome?
Syndrome.
Syndrome.
So loperamide is safe to use in children under 4 years.
Yes. From 18 months or something?
Okay.
From 2 to 5. Yeah, you can give from 2 years of age.
Okay. Thank you.
Just on a side note, why would we be giving Bisacodil for diarrhea? Like, I agree, Reyes syndrome with the salicylate, but why would we be giving Bisacodil?
Actually, it's used to treat it's used to treat diarrhea.
Not constipation.
Ask my Google.
I thought it's used for constipation.
No, it is used for diarrhea.
Janet,
Yes.
have you not sold that drug for constipation?
No, see, I've told it's Google that's telling me. It's not me. It's Google saying it's used for diarrhea.
Okay.
My
So,
Google
but
is
I
saying
think we use it
for
more for constipation.
constipation.
Yeah.
Janet, would you use it for diarrhea? I think that's the question.
I mean, we have a book
Yaani
also like
nasema diamoto
loperamide.
kimoto.
Yeah, maybe they do have that kind of effect, but you shouldn't use it ideally. Then maybe it has a reverse thing going on.
It works both ways.
I don't know. I don't know. So I guess again, that still supports the answer to be diarrhea. That to be bismuth, because why would you be using it for diarrhea? That still supports the answer. I think the answer is Bisacodil. Okay. Why are we avoiding Bisacodil?
Because it is not used for diarrhea. The question is asking for diarrhea.
Or in that case, bismuth is also not used in diarrhea.
Bismuth is used for diarrhea.
You people, now you're confusing me.
It is not given to children under 12.
No, somebody said this. Okay. I was reading the answers in the chat. Somebody was saying, I think the answer is Bisacodil. So we have
Okay, even if it is bisacodyl, you would, I think for bisacodyl, you can give under, I don't know.
But bismuth mainly is used as a nini, as a antacid or what?
yeah.
Okay.
Under guidance the patient has, so it can be, bismuth can be given under guidance if the patient has severe diarrhea, so it should be C. But then again, if you give bismuth, you'll be risking the raised syndrome, as Trina has said. Even if it's used in diarrhea, you'll still be risking it. Oh, that's why the under guidance is coming in. Madaktari, a child comes in and shares diarrhea and have all these drugs. What will you avoid like a plague?
I wouldn't even think of bisacodyl. You know,
So you will be avoiding it.
I mean, I wouldn't even think of it. That's the thing.
Okay. So you will think of bismuth, but you'll avoid it. You see?
Anyway, I think for that one we can just tie it and move on.
Yeah, I feel like it's best to
Yeah,
consult a healthcare provider for that one, since you guys are proving to be very good healthcare providers.
yeah. I mean, we are saying we give the person bisacodyl. Anyway, hata mwili ujiponya.
Mwili ujiponya at the end of the day. Shouldn't have been resilience. Aya, let's go. Hey, Bisacody si mtawa mtoto na dehydration. Hey, you guys. You guys are killing patients. Ndo mmeambiwa. Let's go with Bisacodil. Hey guys, tuletee mtoto wangu.
Perhaps Edwards, or I'm looking for the working class, and Rebecca can chip in. You know, those are they are working in hospitals. Maybe they've seen these things being given.
Aya, you either kill that patient or help that patient. So this split votes between Bisacodil and Bismuth. Mtajulia mbele. AJ is a 70-year-old newly diagnosed hypothyroid patient. What side effects should be closely monitored during therapy with levothyroxine? Is it the blood lipids, the creatinine levels, liver enzymes, or arrhythmias? I think it's arrhythmias. Yeah, wheaty. Aye. So which of the following is not a function of the drug label? To indicate clearly to patients on warnings or caution, to indicate to patients how the product should be stored and for how long, yeah, to contribute to the good appearance of dispensed medicine, to give clear instructions on how and when to take or use the medication. Yeah, I think it's C, yeah. Which of the following drugs can be given as fortnightly injection to treat refractory and severe asthma? Yeah, this one I forgot. Staphylococcus, omalizumab, salbutamol, budesonide. Omalizumab. Ah, okay.
Why do you give it fortnightly?
Maybe Fatima can tell us.
If I'm not wrong, I think it takes a long time for the effects of omalizumab to be felt. I think up to 8 weeks, and then thereafter is when the patient can feel the effects of the drug. But in case someone knows the exact time, I think it was 8 weeks. But in case someone knows, maybe they can share. So just generally it takes long half-life. And also it has a long half-life, and also the drug itself takes a long period before the effect of the drug are felt.
Yeah, it also takes an hour to be okay. Yeah, it takes about 7 to 10 days to reach 62% availability. Which of the following plant growth regulators promotes food reduction? Cytokinins, auxins, cytokines, ammonium phosphate. So there was also, I think, cytokines, those who were saying, yeah, C, auxins. Maybe we can say the different plant hormones and their functions to help us, because maybe it would be a different thing. We can remind ourselves that one quickly. Can give us a summary.
Okay, so auxins, they control the cell elongation and processes like apical dominance, phototropism, and root initiation. Then you have the Rallines that promote stem elongation, seed germination, and fruit development. Also seed dormancy. The cytokinins are involved in cell division and aging. Then you have the abscisic acid. It regulates the seed dormancy and the stomatal closure of stomatal closure. And then you have the ethylene that's responsible for fruit ripening. The jasmonates that are associated with plant stress, and brainosteroids play a role in cell elongation and response to light. So I'll go with C.
Makes sense. Somewhat, okay. For the different types of viscometers, indicate whether it's recommended for measurement of viscosity, either as Newtonian fluids or both Newtonian and non-Newtonian fluids. So what are Newtonian fluids? Si ikikuja kwa pharmaceutics mnatulia. So Ahana said follows Newton's law of viscosity. So Newtonian fluids such as water do not change viscosity when force is applied. Non-Newtonian such as ketchup changes viscosity when force is applied.
Then maybe we can also look at the types of non-Newtonian fluids. So if you have the plastic flow, there'll be no flow until you apply some shear stress. Then you have pseudoplastic when the material force is applied, but there'll be a decrease gradually as the shear rate increases. And you have the diluent flow. Viscosity increases as the shear rate increases. And I think most pharmaceutical products use non-Newtonian. I think, I'm not sure.
And then for non-Newtonian, we also have exotropic and rheopectic. So for exotropic, usually viscosity usually decreases with time. And then for rheopectic, viscosity increases with time. There's another one known as Bingham. I'm not sure if it's Bingham oil or Bingham plastic. And then now, usually that fluid, it's like toothpaste. So it appears solid until when a force is applied further to it, like an increasing force, and then now there'll be deformation. Yeah. But this is a viscometal CJ.
So she has gone ahead to give us pepper salt. Don't ask me how any of these viscometers look like. Corn and plates ni both. Corn plates. I'm a corn and plate.
Okay, according to our notes, it's saying corn plate is used for non-Newtonian, and there's also cup and bob viscometer that is used for non-Newtonian. For both, we only have the concentric cylinder. Maybe somebody can correct us, but that's according to our notes.
Okay, so according to Shina's notes, conflict viscometer.
Okay, not mine. Dr. Muniendo's notes.
Okay, so the conflict viscometer is for the non-Newtonian fluid. Suspended level meter is for the Newtonian fluid. Oxford YouTube viscometer for Newtonian. Falling sphere Newtonian concentric cylinder is for both. Okay, remember like 2 of them. Okay. Move on to the next one. So during treatment of status asthmaticus with salbutamol nebulization, a patient becomes weak and develops arrhythmias. Which electrolyte may have been affected? Potassium. Yeah. The doctors are up and busy. We're going to the next. Angiotensin 2 receptor blockers prevents formation of angiotensin 2, includes spironolactone, decreased preload and afterload, increased risk of kinin-related coughing. That decreased preload and afterload. Because angiotensin 2 will still be made. See, both S and ARBs do that. Decrease preload and afterload. Thank you for that. A relatively high dose of theophylline is required to attain therapeutic plasma concentration in those receiving erythromycin, smokers, those receiving cimetidine, congestive heart failure patients. Can I ask why? Why it's required higher? Why it's higher in smokers? Oh, nicotine induces metabolism and clearance of theophylline. Okay, thank you. So biopharmaceutical classification system, class 2 drugs include the following, except I don't think you have answers there. The leaves and twigs of Cazadue leaves are commonly used as plants.
Your BCS, like, can you just
Yeah, I thought you would have found the the question uko mbele again. Okay, so biopharmaceutical class 2 classification. I even can go through all the classes. Yeah, I think Shina has sent us the classification for those the pharmaceutical, the BSc classes. Class 1 has high permeability, high solubility. Class 2 has high permeability but low solubility, such as the atropine, carbamazepine. Okay, it's like 3 or 4. Class 3 has low permeability and high solubility, such as the aciclovir, atenolol, cimetidine, ranitidine. And class 4 has both low permeability and low solubility, such as furosemide and chlorothiazide. So, which of the following equipment is most suitable for concentrating a heat-sensitive and highly viscous liquid? Climbing film evaporator, freeze dryer, drum dryer, falling film evaporator. And 77D, the falling film evaporator. Lynn and said the falling film evaporator. Yeah, I also think so. So, equipment for heat sensitive and highly viscous liquid, use a falling film evaporator. What did you go with for 83? I don't even know what 83, which question that is. Shina, what did you go with for question 83? What was the question? Oh, bismuth. Okay. People argued between bismuth and bisacodyl. Their question was, why would you be giving it for diarrhea then? Okay.
Janet, umesema number 85. The one for the leaves and twigs of Catha edulis are commonly used as plant of drug abuse in Kenya. Okay.
The most prominent early signs of poisoning by carbamates and organophosphate. So the most prominent early stages of poisoning by carbamate and organophosphate insecticides is tremors, muscle twitching and vomiting, respiratory distress and headache, nausea, salivation and sweating, paralysis, and blood vision. I think respiratory depression is the last one, right? If I'm not wrong. I think that's the last. That one is out. Nausea, salivation, and sweating, tremors, muscle twitching, vomiting. V. What is V? What is V?
B is respiratory depression and headaches. I feel like that's the last one.
That's why I said V.
B. For this question.
Oh, I don't know which person they're answering. V. Oh, okay, maybe the example for this. V for van. Okay, maybe.
Hey.
My responses are jumbled up.
So
let's go back to number 83 because see if we are still debating on it in the chat box. And so Gaia said that if he was having a chemist that was well stocked, he wouldn't even look at Bisacodil. I don't know if that means he's avoiding it. Keyword be well, yes, and the 4 years with diarrhea. The reason they said because you can't give Bisacodil to somebody who has diarrhea, so you should not give it. That's what they were saying. And others are still on Bismuth. Hii kelele ni sijui mtapeleka wapi because mimi nitengeneza. So, yeah, ideally you shouldn't even be considering
Enda tu
Bisacodil.
na C. Hiyo ni C tu. Hiyo hakuna otherwise.
Haya. So you're saying you would give them Bismuth? Patrick.
Yes.
You-
The question is, which should be avoided?
Avoided.
Yeah. That's what I'm saying. So you
Basically, I'm just saying I'm neglecting choice A because it has no indication in this patient at this point, right? But Bisacodil will worsen the effects and it will increase the diarrhea.
Let's think of it this way. Between the Reyes syndrome and the diarrhea, which one will kill faster? Under 5 and under 5.
Diarrhea.
I think diarrhea.
so you have gone to which one you kill first. Okay.
I've said we think of it that way. Yani in at least months nini.
Yeah. But Patrick, me, I'm finding several articles that are also saying Bismuth can be used in diarrhea. Let's go on.
So the answer still is C.
Then the answer is C.
Yeah,
Yeah.
the answer is C. Mm.
Okay.
What did we say? Why are we going for D? Yeah.
I don't know. I just followed the person who said it's that one. Also, Google said so. We didn't give a reason why. Who told us? Or who can tell us the reason why?
Okay, from what I've seen, the photo the photo looks like the highly viscous liquid. Can I draw on this?
Yeah.
Okay. So it looks something like this. So your viscous fluid comes in through here. Then there's like a kind of partition in between here. So the viscous fluid will flow through this. Then here you have steam coming in and condensate coming out. So on like when you put your viscous fluid in here, it will flow down because gravity and all. But this steam will kind of concentrate it before the steam is now cooled back down into a liquid, which is water, and it flows out. So by the by the time it's getting down here, it's been more concentrated. That's like the simplest understanding. So like huko kwa sides kuna tubes za hii steam ina flow alafu inakuja ina exit hapa. Sijui kama ina make sense. Ina make sense.
Okay, what I'm seeing is freeze drying is more effective compared to the other methods.
What was the explanation?
It's saying freeze drying is a process that involves freezing the liquid at very low temperatures and then removing the ice through sublimation, where ice changes directly into vapor, blah, blah, blah. Then heat-sensitive compounds are preserved because they are subjected to minimal heat during sublimation. And it's excellent for preserving the quality of sensitive materials such as pharmaceutical products. And the highly viscous nature of the liquid is not a problem. But for the other options like climbing film evaporator,
That can't work.
yeah, because it can be detrimental to heat sensitive products and highly viscous liquids might not flow. Then for the falling film evaporator, also apply heat to remove the solvent, which may not be ideal for heat sensitive substances, but they can handle the viscous liquids And for the drum dryers, they use hot surfaces to evaporate the liquid. So you can't use heat sensitive material, and highly viscous material might not even spread evenly on the drum surface.
Yeah.
So
So
the
the
best
best one
time,
is a freeze dryer.
yeah.
Okay.
Should I go to the next one? Does freeze drying also concentrate the liquid? I don't know.
Here are the prominent early signs of poisoning.
I think the answer is C.
Nausea, vomiting, and salivation.
Mm.
Okay. The most reliable indicator of cholestatic liver disease is ALT. This is aspartate aminotransferase, gastrin, alkaline phosphatase, alkaline aminotransferase. Arrows, I think alkaline phosphatase, but I don't know. I am not sure. Maybe we can go through some of these markers after we
In
answer
the
this
morning,
question.
in the morning when we were doing this, we said ALP and GGT increase for cholestatic liver disease, but if it is cirrhosis, then you'll have high AST, ALT, GGT.
Okay. And in MI, which markers show at what times?
I don't know for that.
There's a question I've seen in, well, not in PPB papers, but I think we've done them in different papers.
Wait, so for cirrhosis it will be what?
Troponin. High.
For cirrhosis will be?
GGT and ALP.
ALP is alkaline phosphatase.
Yes.
And the
And
answer still for cholestatic liver disease is still ALP.
Yeah.
Okay.
Next thing ulikuwa natuambia hiyo ya troponin. Troponin I is shorter, troponin T is longer. So troponin I is the first one to come up when you're having the MI, and then troponin T later. And between ALT and AST, which one is in higher concentration in liver diseases?
Between what?
ALT and AST. It's actually ALT. ALT is greater than AST in liver disease.
Just to add on that mistake, is that ALT is found in the they are all found in the hepatocytes. ALT is found in the cytosol, AST is found in the mitochondria. So they can all be elevated, but once AST is more elevated than ALT, it points to a more severe liver damage. So they can all be elevated. Typically, it's ALT that would be elevated more because it's the one in the cytosol. But if AST trumps ALT, then it points to a more severe liver damage.
Do you have is there like a specific ratio? And yeah, you'd say there may be severe liver disease. This is the normal ratio.
No, there's usually a ratio. Let me get that exact ratio. But there's usually a ratio. Yeah, you're correct.
Was something else to add? I'm also finding to add on GGT, it's usually the first liver enzyme to rise in the blood when any of the bile ducts as carried bile from the liver to the intestines become obstructed, such as in tumor or in stones. This makes it the most sensitive liver enzyme test for detecting bile duct problems.
Wait, Janet, you are reading on AST or GGT?
GGT, that was GGT.
Oh,
No,
GGT.
that was GGT. Yeah, but it's not specific.
So they've said it's the most
sensitive liver enzyme for testing bile duct problem. Like if you're looking for a bile duct problem, because otherwise GGT is not very specific.
thank you.
Unatafuta hiyo ratio?
Kinda.
Kupatia hiyo ratio atatutumia basi. The AST-LT ratio. So what adverse effects should be suspected in a patient presenting with fever and sore throat despite being on fluconazole? Well, it's anemia, malignancy, hypoalbuminemia, granulocytosis. Well, granulocytosis. Oh, okay. So fluconazole causes granulocytosis. That was a question.
I don't think the question is asking what's the adverse effect of it.
Yeah, I
But
was trying to understand.
But like, why is there still fever and a sore throat despite being on fluconazole? Yeah. So I think I went for a granulocytosis because that would weaken the immune system. That's a weakened immune system. So I guess like that, yeah, less neutrophils, I guess.
That makes sense.
We go for a 5-minute break. Sorry, till I get my charger.
So a patient in intensive phase of tuberculosis therapy develops visual disturbances. Which of the following drugs should be withdrawn? Nice. Ethambutol? I think.
What's the major side effect of isoniazid?
Maybe the peripheral, okay, I don't know. Yeah, the peripheral neuropathy. Said by Dr. Giles. What do you give to counter that or to help prevent peripheral neuropathy?
And hepatotoxicity is for pyrazinamide. Or
Yeah, I see that one. It's a one. Yeah. For the schedule for tuberculosis is usually how many months? Is it tuberculosis? Am I on HIV?
is it
I need
6
some
months or
confused.
3 to 4 months? I don't know.
I also don't know.
6 months, yeah.
Ah, okay. So a chemical disinfectant with a high concentration exponent exhibits no change in activity when concentration is altered, is highly sensitive to dilution, is effective against all microbial life forms, retains activity at high levels of dilution. It's highly sensitive to dilution. What's the meaning of high concentration exponents? Like it just means it's highly concentrated.
My reasoning was
Activity
the
is dependent
concentration.
on the concentration.
My reason was that if the concentration is changed, the chemical disinfectant wouldn't be able to perform function as how it's potent than when it's diluted. Like imagine, okay, a chemical exfoliant, can we use an example like Dettol? Like if you dilute it, let's say in a tank, can it still disinfect?
Yeah.
But using it purely versus using it when it's mixed, would it still disinfect?
Actually, what? Would it go breaking?
Sorry. I'm saying a chemical disinfectant, keeping in mind if you dilute, say like maybe a bottle top in a bucket, and when you use the disinfectant as it is, can it still disinfect equally or in both scenarios?
I guess not. So that's why you're going with.
That's why I've gone with B.
It's highly sensitive to dilution.
Yeah, but I don't know. I don't know. I
Okay.
think maybe Sarafina can explain her answer as well.
Me, my answer is just simple. I feel like if it's highly concentrated, it means that even if you dilute it, the activity remains high. That's it. Like, I don't have a fancy explanation.
A high concentration exponent means that the more you dilute it, the less active it becomes. The longer it takes for the disinfectant to kill
Okay.
the whatever the
So if
bacteria.
it has a low concentration exponent, it means it's less likely to change when you dilute it.
Yes.
Okay, so then the answer will be B.
Yeah. And why do we use 70% alcohol for disinfection and not like 100%?
I think the 70 during Corona period was like because it's for hands, like maybe 100 would like damage people with sensitive hands, something like that. I don't know, but it was never going above 70. I think it's because it's used on hands, but I think in other scenarios, if it's in the lab, 100 would be used.
Ya 100 utakunywa jana.
Ati
I
100 utakunywa?
said 100 si
Relax.
utakunywa.
Relax. Okay. So to the next question. Wait, I'm finding a different other answer. Can also be, I don't know if this is true, but also 70% alcohol will take longer to evaporate. And this contact time it will be important in increasing its efficacy or its effectiveness. And also it's cheaper. Biopharmaceutical classification class 2 drugs include all the following except we had tusema class 2 classification zinazikuwa na high permeability, low solubility.
Yeah.
So that will be carbamazepine, except like carbamazepine is there, proconazole is there.
Theophylline is one.
So nifedipine is the exception. Oh, you said theophylline is one. Okay. To calculate the pediatric dose of a child, the following are considered except the age, the body surface area, the body weight, sex of the child. G. G was the sex of the child. I. Optical microscopy is used for qualitative and quantitative examinations of suspensions. However, it has limitation in the determination of size, aggregation of particles, shape, morphology. ni kati ya aggregation of particles and morphology. Yeah. In suspension. Well, in morphology, does morphology include like the shape or the particles or something like that? In pharmaceutics inaitulemea.
I think
So you have studied
morphology include the shape and size. So A, C, and D, I think are just the
the same thing. Yes, Hirala studied the optical is useful for observing morphology. So yeah, by elimination, it's B. Somebody has a better
Okay, so
explanation or
where it's also written. Okay, Google says it's also useful for observing the aggregation evolution over time. So I don't think this question has an answer.
So a 20-year-old patient presents dysentery. Stool analysis yields yeast and trophozoites of C. histolytica and C. jejuni. The most appropriate treatment is madaktari. Just remember ni ciprofloxacin, metronidazole, and diloxanide furoate. Why? Why that combo and not all the others?
I thought I'm saying this because ciprofloxacin is mainly okay. According to the notes, I know that you give fluoroquinolones, metronidazole, and voluminal, as we discussed in the morning, you give diloxanide furoate. I'm not sure, but yeah, I feel that's the answer.
I think diloxanide is active against the cyst form. Metronidazole is not, so you need to combine the two.
Yeah. Wait. So match the following types of surfactant to its proper class. So with an ester, I don't know.
Wait, Janet, let me ask for the previous question. We had discussed in the morning that metronidazole was both for the luminal and the extra intestinal, yeah?
I
The
think we
metronidazole
discussed the
in the morning,
metronidazole.
was it for both extraintestinal and then the luminal whatever infection?
Yeah, they said also the quinolones are mainly used for the extra intestinal also.
Oh, okay. Thank you.
Yeah, but I think metronidazole, I I think will it be effective extra? I think it will be. I think so. Yeah, we're trying to be very effective. We can go on to that other question for the time. Shina, yeah, we will. So it's matching the type of surfactants to its proper class. And remember an ionic. Na hiyo umejua okay. Lecithin is a zeta ion. Yeah. Alkaline soaps are anionic. Polysoap is not ionic. So do you have like a table or like a list of the different classes and examples? Can send to the group.
Yeah, I don't know. Somebody had sent it on the group. I'll look for it. But what I remember is anything that is starting with C, like cetrimide or this is benzyl something, those all of them were cationic, and anything that had sodium in it was anionic.
Okay.
Yeah.
So the pseudoplastic flow behavior can be explained by the apparent viscosity. I want to go with it because there's a word viscosity. I don't know the answer. Hey, you guys, you're really going silent on the pharmaceutics question.
Na si ndio, si tulifunzwa na Munyendo, unakumbuka kitu?
Sasa sisi sote tulifunzwa na Munyendo. Nao wengine what's their excuse? Mi na kama answer ni apparent viscosity. But kuna pia yield value, doesn't it? Wait, no, yield value is out.
We all have our munyendo.
Yeah. Mtaachieve hiyo ML3 nini? Anyway.
Kwanza ni
Yeah, then
pigana nayo.
wewe ushawa yule mtu wetu na visako ndio tuanze hapa. So wewe uko nje clinical, uko nje industrial. Pick your area.
Anatomy.
Utapata swali
Upate
ya
alafu
anatomy.
upate alafu hakuna anatomy, utaenda kulia kwa kona.
Yo, I'm finding it on the internet and same question and they went with apparent viscosity.
Yeah, hapo ni apparent. We can, yeah. Tunajua.
A 78-year-old female presents to your pharmacy with a prescription. Which of the following drugs should not be dispensed to her for her hypertension? Guys,
Body na pia hiyo 48-year female.
78. Hey, why not methyl dopa? I was told as much as, well, niliambiwa that it really doesn't have an
TB is
effect.
methyl dopa.
Yeah, but I'm asking why methyl dopa?
Because the others are used for hypertension.
I'd say because the elderly would be more sensitive to the ADRs of methyl dopa. But
So because of the posterior hypertension.
yeah, the lightheadedness, yeah. So, but truly it was more of a picky for Pia Camelo.
Yeah, because I've seen it being given. Methyl dopa has been given for older for geriatrics. Like it's not contraindicated for it's still given. So people have not been avoiding it, or yeah, kuna wenye wanasema atenolol.
Atenolol ni selective ama non-selective?
Selective.
Basi kama ni selective, it's okay. So why atenolol for those saying atenolol?
It seems to have age-related liver, kidney, and heart problem. According to the internet. The atenolol may cause heart failure in some patients. So it seems to have some adverse effects based on age. Based on age, it seems to have adverse side effects. Because methyl dopa is relatively safe in the elderly. I've seen it being given.
It is. It is.
I think it's more class.
So A is the answer.
Yeah. Okay. I'm also siding with A. But then again. So keep trending again. Can you repeat why it? According to my internet search, it's saying atenolol has been associated with liver, kidney, and the heart conditions based on the age. And also it has been found to be a risk to have a risk with causing stroke. Somebody else is saying benazepril, an ACE inhibitor, that's risk of postural hypertension and cough. It also requires renal adjustment. So this point, mtu mwingine aseme I'm low DP. Hey guys. So other than guys doing picky ponky for me, they'll drop her. And what other reason would disqualify it from being given to the elderly? Oh, so you
What
agreed.
I know is generally in the management of hypertension, is for older persons, beta blockers are usually avoided. And the reason they're avoided is the risk of bradycardia and with atenolol kidney issues. And again, bradycardia can affect kidney function. So most of the time, hypertension in elderly patients, beta blockers are usually avoided. Like not avoided, but they're not something that comes fast to your when you're thinking about managing hypertension in the elderly.
Okay. And when we talk of geriatrics or the elderly, what is the age like? What and above? At what age does it start to be the elderly?
First retirement age, I don't know, 60 plus.
People retire at 20.
Hapana, ile ya government, hii ingine achana nayo.
60 plus years, okay. So tumekubali ni atenolol, songe. Okay. You know, we're waiting for you. Yeah. Oh wait, let me ask. Did the S and the ARPs, did they have not cardioprotective? Did they protect the kidneys? We went with atenolol. I will on it. Which of the following? Yes, they do. Thank you. Which of the following medication should be avoided in breastfeeding? Ibuprofen, propranolol, naproxen, methotrexate. The Dr. Viola has told us it's methotrexate. A 35-year-old male with a history of diabetes is prescribed captopril 6.25 mg TID despite being normotensive. The rationale of this recommendation is to slow down the development of nephropathy, improve contractility of the heart, control blood sugar levels, decrease progression of neuropathy. A certain person has slowed down the development of nephropathy. Yeah. So itakuja with the renal protect. Okay. Support Kosa, I feel like you've covered diabetes intensively. Ah, yeah, finally. A good doctor has confirmed it's A. So in a child with hypernatremia and dehydration, the priority is restoration of intravascular volume by 50% glucose, normal saline, Hartmann solution, lactated Ringer solution. Which fluid is used for rehydration? Normal saline. Hartmann solution ilikuwa ya nini? I normal saline. So what is Hartmann solution used for? Mwenye ameandika RI, what is that? And also, can Hartmann solution be used for the restoration of the intravascular volume? Just a question.
Ati Janet umeuliza
Hartmann solution, can it be used for the restoration of, in this case, because the child has hypernatremia. Oh, the child has hypernatremia. And okay, hypernatremia and dehydration, high sodium. But
Yeah,
then,
let me see. Hartmann solution it has.
but then the
Hartmann
hypernatremia.
solution. Yeah. Hartmann solution. It has compound sodium lactate. it contains sodium chloride immediately? No, I don't think so. So if you have hypernatremia, you have a lot of sodium. Hartmann
But
solution,
normal
it has
saline. Normal saline
me
has
just
sodium chloride.
me just sema hiyo ni answer yangu.
Okay. But I was
That's
saying,
not what
you know,
I said.
hypernatremia and dehydration is caused by the low blood volume. Yeah, because you have a low volume, that's why the sodium becomes concentrated.
So me, my answer is D.
Nakupea D5.
Answer yangu ni D.
Mm-hmm.
Because lactate ringers injection is used to replace water and electrolyte loss in patients with low blood volume or low blood pressure. Mnafikiraje?
Kuna mtu
Mimi
amesema
Answer
ningepeana
yangu ni
D5.
Hartmann solution.
Mimi ningepeana D5.
Haya.
How about Hartmann solution? Because here in Google, I can see Hartmann solution. It's used to
Ringers.
replenish fluid and loss of electrolytes.
Hartmann and
But
Ringers.
Hartmann
Sodium.
solution,
Okay, one
But
at a time.
akona hypernatremia, so
I
we
think
should take
Hartmann
that into
solution and Ringer's
consideration.
solution is the same thing.
Okay, Patrick, why are you giving glucose?
It's not. It's not the same thing.
Because mi naona zote ziko na sodium na akona hypernatremia. Simple reasoning. I may be wrong.
Okay, but 50% dextrose is not used to replace water and electrolyte loss. So it can be 50%.
Yes, in D5, mama.
Not
There's a difference between D5 and I 50%.
Oh, okay. Difference ni gani? Just to get it.
I think it's the concentration of glucose. D5 has 5% glucose, then I think kuna kwanga na 10% na sasa hii 50.
Oh,
Yeah,
okay,
if I'm not
sawa.
wrong.
Yeah, you're right.
Sawa.
You're right.
D50 is normally given as a bolus for those patients who have hypoglycemia.
Correct.
Atiaje? Hypocalcemia. Umesema hypocalcemia.
Hypoglycemia.
Hypoglycemia. Okay.
Yeah. So D50 is out of story here. Hartmann is also called Rigas lactate. Yeah. So
So answer
that's
ni
some.
normal saline
And
by
here,
elimination.
yeah, because this child has hypernatremia.
But both of them have sodium. So we
But the
can take
sodium
that.
which is in Hartmann is a lot.
Okay.
Ukiangalia ChatGPT basically wanasema the answer should be A, because wanasema all the other options are actually suitable, B, C, and D. The only answer that is not suitable. So Patrick might be right in as much as he's wrong.
Wow, bro. CPT.
Wanasema others can be used for sodium restoration in case angekuwa anemia, but sasa in this case ni hyper. So okay,
According to Medscape, it says if a volume deficit and hypernatremia are present, intravascular volume should be restored with isotonic sodium chloride prior to pre-water administration. So isotonic sodium chloride is your normal saline.
Yes.
Yeah, so that's
exactly
on Medscape.
Okay.
Tunaendelea hadi saa ngapi?
Rest is a form of exam preparation, bana. Watu walale.
Mtu
Hadi
asilale bwana.
tumalize. Kama mataka kudoze, sleep well. Wale ambao wataka kuendelea waendelee.
Utalala kesho.
Mtalala Wednesday.
Janet, si hata ukunywe maji bana, umekaukiwa, utadehydrate hapa. Kunywa maji.
Ala, that is personal. Let's just keep it civil. Haya, so tuendelee. Kuna mtu amesema isotonic 0.45. I don't know what that means. Yeah, normal saline. We can take two short breaks in between. Unaona hiyo mmechangamka, ni kama hizi za nini, mnachangamka alafu tunagonga pharmaceutics. Nabaki peke yangu hapa na Shina. So,
At least ni vitu zina make sense.
semeni hivyo na vipatu inakuja. Yeah, we already went with the normal saline. So the residue that remains following extraction of active principles from a medicinal plant is called
Mark.
Is that the mark?
It's the mark. Process inaitwa maceration ama?
Hapana.
Haya.
Oh,
Nimejua.
sijui. Hata mi sijui mbona ina answer. So it is a guess when hapo mark. Tuendelee. Solid extract residue.
So what is the extract?
What is the extract called?
Extract.
Nita menstruum.
Ewe.
Content. Hey, content.
Nini hasomi? Na
Ati
hiyo ndio
inaitwa
nasema
aje tena?
diurese.
Ati inaitwa aje
Menstruum.
tena?
Acha niandike kwa chat.
Hebu andika kwa
Amesema
chat.
Sam amesema at urest. Unaona mwenye ako na content.
Menstruum.
Hyperaldosteronism is associated with Crohn's disease, Cushing syndrome, Addison disease, hyperthyroidism. Okay, I don't know if you guys have discussed, but I wasn't there. Can discuss those conditions except for hyperthyroidism. What is Crohn's disease? And what is Cushing syndrome and Addison disease? So nini mshaanza? Kuna wenye anasema Cushing's, kuna wenye anasema Crohn's. So yeah, I'm right. Let's discuss. What's Crohn's disease?
High levels of aldosterone.
And Cushing's, and what are some of its like symptoms?
Headache, facial flushing, constipation, arrhythmias because of low potassium, high BP, and treatment is just surgery. For Cushing, it's high levels of cortisol, I think. Yes, high levels of cortisol.
Yeah. And some of its common symptoms.
Is it the moon phase? No,
Yeah.
I don't know. Is it the moon phase?
Yeah, it's a moon phase.
Yeah, the moon phase and the buffalo hump. Yeah.
And Addison's disease.
Tell me the treatment for this.
I don't know.
I don't know too. Treatment for Cushing syndrome.
Okay, so what's the treatment for Cushing syndrome?
Mr. Priston. What class is that?
Yeah, it's a glucocorticoid receptor blocker, yeah.
Okay. And the Addison disease?
Opposite of Cole's disease.
So low levels of cortisol.
No, aldosterone.
Oh, Crohn's disease. Oh, aldosterone. Okay. And for its treatment is?
Increase the levels of aldosterone.
Hydrocortisone and steroid inhibitors such as ketoconazole. Oh, for Cushing's, it's
I thought Cushing's is the opposite of Addison.
Cushing is for cortisol, and Addison, we are talking about the what are we talking
No,
about?
it's the opposite. They're the opposites. Like the causes are opposites. Like one is caused by high
Yes.
and one is caused by hyper.
So Cushing is caused by hypercortisol, like high levels of cortisol, right? So
Any other cause of Cushing syndrome?
Somebody to say it again, zote tatu pamoja. Now I'm confused.
Cushing syndrome is caused by hypercortisol.
Yeah.
And then Addison's is vice versa,
hypocortisol. Okay.
Yes. And then there's Crohn's disease.
Guys, kwa hiyo previous question, the ari imesema no content. So actually, the menstruum wamesema ni just the solvents peke yake. Nimetuma kwa group. Ni the solvents that I used. So gas amesema the extract to extract, but menstruum ni the solvents ama the mixture of solvents that will be used. Hope mepata hiyo point.
Sawa basi. Tuendelee. Sasa amekwambia urudie. Nice. So simple alcohols are commercially produced mostly by reduction of aldehyde halides, fermentation of carbohydrates, reduction of acids and esters, hydrolysis of aldehyde halides. Chapa, najua tu mtaninyamazia.
See fermentation. So, simple alcohols are commercially produced mostly by reduction of aldehyde halides, fermentation of carbohydrates, reduction of acids and esters, hydrolysis of aldehyde halides. Chapa, najua tu mtaninyamazia.
Chapa, najua tu mtaninyamazia.
is hydrolysis of alkyl
Sasa naona ni fermentation but hizi maswali siamini kama
Watu wa African dreams tunawaona.
Mi naona ni fermentation. Simple alcohols are commercially produced mostly. Yeah, ni fermentation occurs.
Haya,
Mi ningeenda na hiyo. No lie.
but is it the correct one? Kuna mtu amesema, huyu mwenye amesema hydrolysis. Kuna mtu amesema hydrolysis. But haya basi, enye hizi vitu zingemakiwa. So mainly by fermentation of carbohydrates. Tuendelee.
But according to Google, 90% of the world's alcohol inatengenezwa hivyo. Commercially produced. Ni hiyo
Through
fermentation.
fermentation.
Ni
Sawa.
through fermentation. Tesh bado anasema ni D.
Haitapeana acids, hydrolysis of alkyl. Kuna mtu amesema C. What was C? I've forgotten what C was. Reduction of acids and esters. Here we're talking about commercial production. I think this is a combination of chemistry and here some pharmacognosy. Because all these will give us I don't know about reduction of alkyl halides. Also hydrolysis of alkyl halide, reduction of acids and esters. So me, I feel like for commercial production, I'd also go with fermentation of carbohydrates.
Yeah, ChatGPT imekubaliana na it's actually the cheaper option in all those ones because utapata pia alkyl halides ama hizo
Yeah.
esters. It's easier to ferment the carbohydrates and I think that is venye Patu alisema tu.
So watu wa Rati should take the win and move on.
Na some pale.
Indicate whether the following are true or false. Hydration of alkenes. Yeah, it will give you alcohol, but that's not used like it's not the main way of commercially producing alcohol. But hydration of alkenes does give alcohol. So indicate whether the following are true.
Are we all in agreement for fermentation?
I am.
Now you have a different answer.
No, I agree.
Okay. Hey, what was the answer? What was the question? What is the question? There's no question. I'm supposed to match.
I think you're supposed to identify from this.
Wait. So kuna tumesema the top is F2. And we knew that. Yo, you guys are reading. Kuna tumesema ya kwanza ni F2 na hiyo ingine ni E3. Yeah. Tofauti hizo mbili ni gani hata? Oh, they are, oh, okay. Okay. Interesting. There's no explanation there. I don't know if there's further discussion. So which gas could be used for sparging? Oxygen, methane, nitrogen, fluorine. What was sparging again?
What is
Feel like
Paju?
I've heard that word before. So it's
A
it's a
technique in which a gas is bubbled through a liquid in order to remove other dissolved gases or dissolved volatile liquids from that liquid.
nitrogen. I don't know if the others are used for sparging. I've just heard nitrogen is used.
Just as addition, you can also use carbon dioxide and argon.
And?
Argon.
Oh, okay. So
Nitrogen, carbon dioxide, and argon.
thank you. The indicator electrolyte in pH measurements is aging is silver chloride, saturated column electrolyte, liquid membrane, gas. That be silver. Is it A? I do not know. Yeah, it's a silver chloride. Although mercurous, the column electrolyte is sometimes used. That I'd go with the silver chloride. G, glass membrane electrode. Yeah. I didn't say it's not. I just said silver chloride is used. I don't know why not glass membrane electrodes. So for the saying glass membrane electrodes, why not silver chloride? The most widely used
Yeah. So
electrolytes is a pH electrode, which utilizes a thin glass membrane that is responsive to changes in pH activity. So
or
silver,
rather for you,
silver.
why did you go with silver?
Because that's what I got when I Googled that question.
Ah,
I mean, that was the first answer I had in mind, and when I Googled, it was also among the first things I found.
okay, let me send a screenshot that silver is not there.
Hey, I'm throwing away my Google now.
Na ulikuwa umesema unaingia na simu hiyo simu.
The first one I gave you, my
Got a
okay. Hujatuma na wewe unajua si yake na kudanganya. Mali yangu inadanganya. Umetuma? Guys,
Yeah.
ana nimepata ingine
Doing
inasema glass.
upload.
Na nimepata ninasema glass pia.
Usiingie na simu. Clearly.
Hata sikuwa na plan. Sawa. So the neutral sugar is glycosidically bond to macroside.
Daktari. Kwani umelala? You
Why
watu
are you-
wamesomi. Watu wamesema
Why
ati
Mr.
tuna translate hadi saa 9 man.
Mr. Lovalava mute?
Hata sijui
Hata unatu
sijui
interrupt,
maybe
tulikuwa
niendelee
katikati
hadi
ya
12
question.
nilale.
Tulikuwa katikati ya question tunasomewa. Bora
Mhm.
usubiri.
Ati
Ati aje?
amemute laptop akifikia ametumute. Amejimute.
Ndio hiyo sasa. Mm.
Eh, bana.
By the way, sikia msee like amechangiwa grade ama kitu kaa hiyo after paper.
Bado anataka kaenda kuchange.
Unajitetea na hujafanya mtihani jamani. Fanya mtihani kwanza.
Wacheni atuambie Mo. But hebu tuambie.
Ameishia.
Okay. Mm.
Na ile ugali
Okay.
iliiva. Kulikuwa na ugali ingine pia ilikuwa
Mazee hii kitu
inapikwa.
inanipea pressure. Sijui mbona inanipea pressure hivyo. Mm. Anyway, kwe lala. But kesho nenda rehearsal ama nyie mwendi? Au mnaenda? Okay. Sawa. Tutapatana huko basi. Saa 8. Okay. Tutapatana huko. Bye. Good night.
Patrick.
Patrick umerudi.
Patole.
Unafanya nini kesho?
Sauna mute sahi.
Who are you meeting?
Acheni ujinga. Wow. Yaani guys hawezi ni mute. Ni sawa. Nimekuona.
Tuambie kama grade changiwa.
Tulia.
Tuambie kwanza kama grade chini.
Ilikuwa commercial break. Thank you, Janet, unaweza endelea.
Nimeona pia ugali iliiva.
We ni fala sana.
Natural sugar, which is glycosidically bound to the macrocyclic ring in erythromycin is watu wa medchem kujeni mshani ambayo ni cladinos. Okay. So match the following drug the most appropriate statement about its metabolism. Hizi mnajua. Allopurinol inhibits Zanli. Paracetamol toxicity na PQI. Oh, paracetamol metabolites na PQI. I don't know how it's pronounced anyway. Alafu kuna ethanol metabolites, isoniazid main process. Haya.
I don't know for the last two.
Ethanol metabolites, that's acetaldehyde.
Acetaldehyde, the other one is N-acetylation.
Hizi si zenye tulikuwa tumejibu before. These are different ones.
Yeah.
Bana.
I don't even know if
Remember
I've
drink.
done that.
The things you just need to know.
Is this one misoprostol or D1?
Let me Google.
Okay, I think this is misoprostol. No, D1. So this one is thromboxane. Structure
Yeah, somebody has said
thromboxane.
that is thromboxane. It's not misoprostol, so I guess it's the one here.
Do this true and
true,
false
false.
return item. we finish this page and then
put it for a vote.
Only we didn't agree with
Yeah, that's we're finishing the paper base now. We just took a commercial break.
surely. See, we just do it.
Yeah, protic solvents are those that have a hydrogen bond to an oxygen or nitrogen or strongly electrophilic atom. Sema protic nini, it's likely to give off hydrogen. So now according to this one, I don't know. Is that true or false? Chemistry na hiyo ingine inaolemea. Mimi niko hapa. Yes, protic, that's true. The person is true. Enamines are found when aldehydes and ketones react with secondary amines. True or false? Carbonate. I think that's true. I think that is true. Because my Google, which has apparently failed me several times tonight, says enamines are found by reaction of secondary amines with carbonyl compounds. So see, aldehyde and ketones are carbonyl compounds. So this one makes it true. Tertiary carbocations are less stable compared to secondary. I think that's also true. Amines may be prepared via reduction of nitriles. Oh, wait, there's something else I learned. Seems to have forgotten. Amines may be prepared via the reduction of nitrile oximes and amides. Tertiary is false. Okay.
Tertiary carbonation is more stable. They go from tertiary, secondary, primary, and methyl. So tertiary is the most stable.
Okay. This is why I don't trust my internet. See. Hi, somebody can confirm. No, not ingine. Somebody saying it's false because it's only formed from ketones and not aldehydes. Actually, it is both. It does react with both aldehydes and ketones. Amines may be prepared by the reduction of nitriles, oximes, and amides. That is false. What's an oxime? Oxygen is an OH attached to a nitrogen of an imine. That makes sense. Resonance structures are defined as being structures that differ only in position of the electrons. Tuendelee ama tusiendelee?
Iko nini? Tuendelee.
To be or not to be? Ungesema tuendelee.
Tuendelee.
Kesho, what time should we be there for rehearsals?
Rehearsal is at 2.
Oh. Which detail? Okay, I think this assessment isn't fair. We didn't learn this. Which details? Oh, of Kumali. But these are a lot of, there are 106 questions. I don't know how many we've covered so far. Tulifunza vitu general. Poleni kwenu. Hata sisi tulifunza
Wala
general.
sijafika hata nusu, acha nikwambie.
Aya, tuendelee basi, at least tusonge kidogo. Hata kama, because we don't have enough time. We need to cover all this na bado we don't have enough time. Match the following amino acids with their corresponding chemical characteristics. Anyway, no, this hey, I feel like this one you just need to know. You just need to know these amino acids groups and their structures. So bado sijazikram, sijui nitatoa wapi photographic memory. At least najua histidine has sulfur, I think.
Ndio iko na sulfur.
Yeah. Cysteine, sindo?
Mm. Glycemic acid inakuanga acid.
Ati?
Glycemic acid iko na carboxylic acid because it's an acid. Tyrosine lazima kuna inaitwa nini? Hiyo aromatic ring.
Yeah.
Basic ni histidine.
Na proline?
Sasa sijui kama ni hiyo ya alpha chain. Proline siko sure.
Yes, it's that one for alpha. The nitrogen atom is attached both to the alpha carbon to a chain of 3 carbons.
Janet, where are you?
B. A. The first one is misoprostol because it has a methyl group.
The structure is for
I think the ketone is not clearly shown, but I think it's there. It's a D one. If you check there down, I think that branch is not well. Whoever took a photo, I guess the photo is not clear.
I think we saw previous D1s. I'll just leave this out.
This D.
Then what did the Hans rule?
For Hart's rule, hello.
And then I have a question, Trina. What was the name of the principal that said the election has to fill lowest energy orbital first before moving to the higher energy orbital.
The off-boss principle.
Oh, yeah.
Okay, found something on Hans rule or inasema Hans rule. So this rule states that when filling degenerate orbitals, basically orbitals with the same energy, electrons occupy each orbital singly before pairing up, and they have the same spin. Oh, yeah. So basically hii ilikuwa inasema I think tulikuwa tunaweka like as in okay, kama tulikuwa na dash mbili like utaanza na spin up then spin down ikuje kwa hii dash ya kwanza alafu iende kwa hiyo dash ya pili. I don't know if you guys are understanding. The dashes are representing orbitals. I don't know if you guys remember that, but does it make sense? Let me just share what I'm finding alafu you'll see if they make sense to you.
Why is it Hard's rule and not Pauli's principle?
For this one, we say the answer is Pauli's principle.
But when we're
Oh.
talking about the spins, I think it's the Hans rule.
Yeah, that's true.
Pauli's exclusion is mainly for the it's saying that no two electrons within an atom may have the identical set of all four quantum numbers.
Yeah, hata diagram yenye nani ametuma I think ina show tu vizuri. Okay, but in as much as nini inaisha nini hiyo Pauli's principle ina state hivyo basically it's usually more pinned down on the spin because all the other things can be similar, but I think what they usually differ in is spin. Like basically if one of them is a spin up, the other one has to be spin down.
So by what has been sent to the group, the answer will be Pauli's principle, yeah?
Yes.
Yeah.
Okay.
Like Pauli's principle can still deal with spin, but the only ni venye tu hapo I think they
The
just
hands
made it
is the one that we use when we are naming, the one for like 1S, 2SD, whatever. Is that what will be the hands rule?
not really, but okay, not
That is
really.
alpha bows.
Okay, what is quantum numbers?
Okay.
Yeah.
Basically, okay, see kuna those numbers that we used to give them. Okay, sijui nitasema. Okay. Hi. Okay, basically that's
Two.
okay. So Srin, I think what you're saying. Oh, exactly. Like Nona, like how you can say this is a 1s. Okay, send me a 2s electron. Na kwa hiyo 2s we have two electrons. Like those two electrons, they don't have the same they don't have the same set of quantum numbers, in as much as they're both 2s. One of them needs spin up and the other one needs spin down. So basically spin half and spin negative a half. So that is what makes it different in terms of having different set of quantum numbers. But at the end of the day, they're still the 2s electrons, but not completely 2s, because one of them is a positive a half, then the other negative a half. So that is what the positive a half and the negative a half, that is what will be denoted by the Pauli's principle. I don't know if you're getting what I'm saying.
Yeah, I get you. And so now when we're talking about the Hund's rule, you will fill
So basically,
them like if it is 1s2, they'll have two opposite, 2s2, they'll have opposite, and then two p1s, all of them will face in one direction, Ama.
Okay, I think ni difference kidogo. So hapa wanasema Hans rule, it says that when filling degenerate orbitals, so it's basically when we are filling them. Like in a described to, or it usually describes what happens when you're trying to fill the orbitals. So say we have from the diagram in Srina sent, so we have a couple of orbitals over there, like the 1s, 2s, then tuko na hiyo 2p. So what is happening, like we used to fill them like this. Unaanza na 1s, you put the arrow facing up. Then kwa 2s, unakuja the arrow facing up. Then kwa 2p, the arrow facing up. And then you start adding other electrons. So the next electron, unakuja tena kwa 1s, you put the electron facing down. That is spin negative a half. Then this you go to the next one. Like basically it just describes what happens when, or how these electrons are actually filled in the orbitals. Like they're not filled as in, you don't fill them like 1s, then you put the half up, half down, then you go to 2s, you put half up, half down. You start by putting like the up ones peke yake, the up peke yake kwa ps or sp, then you come again kwa s, then you put the down, then you go to the p, then you put the down. I don't know if you're getting it. Like, okay, if you had 6 electrons,
It's single.
this
You
particular,
just do single occupancy before pairing. You cannot pair.
yeah, exactly.
Yeah.
Exactly. So that
I
is
think
what has
this,
really been described.
so
But
then
in
the
simple terms,
from what you've sent, I'm saying that Hans rule is the direct answer.
As a first year has told me, it's Hans rule.
Yeah.
So it's Hans rule.
Wow, yani umeambiwa na gradient ati ni Pauli, lakini ukienda na first year's hands rule. Sawa. Na
No, yeye
unataka
ndo amesoma
kulala?
juzi.
Yeah, I think we are all drained. We can stop here, please. We
no,
meet
it's not Hans
Before
rule.
you stop, can I say something?
It's not
Yeah.
Hans rule. Kwa sababu, okay,
I
what I'm
think
saying
this
it's not Hans
statement
rule.
is combining both Ansru and Paulis, because when we talk about spins, that is Paulis. When we talk about filling the orbitals, like 1s, 2s, then we go to 2p. 2p has 3 subshells. So in those 3 subshells, you have to fill the electrons facing upward first. Then you continue to pair. That is hands. But when we talk about spin, we talk about Paulis. The statement is combining the 2 principles.
Okay, not really, guys.
So I'm not sure
Let me
the
just
answer.
explain it let me just explain it in a different way. So basically what they're saying, usually in an orbital, in all orbitals, it doesn't matter which orbital it is. You can only have 2 electrons, right? One has to be spin up and the other has to be spin down. So they're asking what rule states that one has to be spin up and one has to be spin down. I think that is what the question is asking. Because Amuliza, and the 2 spins must be anti-parallel. Basically saying one electron must be spin up, the other must be spin down. Like that is basically Pauli's principle. As in, it's not about filling them. Like it's only that wamekwambia, like in an orbital, you have to have 2 electrons. Like you can't have more than 2. It's basically just, I think, a way to confuse you because I'm a story mob. But at the end of the day, they're asking what rule in a state that you only have to have 1 spin being spin up and the other one being spin down, because your statements are anti-parallel. I think that is okay. Let me just get it directly from the AI, then I'll share it with you guys. But I don't know if you guys are getting what I'm saying.
Me, I'm getting it.
You guys left. Like they're not like it's not about feeling. Like they're not talking about feeling. Like they just give you a statement. Like it's like I told you, like you're allowed to only check 2 mangoes. And 1 mango can be right, the other one and right. Then I'm asking what rule sets that. It's not about a rule that talks about you taking mangoes. Okay, I don't know. Okay, it's confused. That is even more confusing. But I'll just send an answer from ChatGPT, then you can see it. But it's actually Pauli's principle and not Hans' rule.
Oh, we can look for the difference between the two.
We can settle on this answer on a fresh morning. I'll just start this. We'll start from here. Okay. Thank you, guys. Have a good night.
You too, Srina. You too.